And welcome to the Dr. Bob Show. We're going to be spending most of this show talking about a creative, new, exciting style of medicine. My guest is Dr. Rocio Huet, board-certified internal medicine specialist and board-certified in integrative medicine and acupuncture. She's going to be answering our questions about this new type of medicine to help your health and my health. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about the difference between diverticulosis and diverticulitis, and we'll be talking about harmful effects of bad cholesterol. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Rocio Huet, board certified in internal medicine, board certified in integrative medicine, and board certified in acupuncture. Rocio, welcome to the Dr. Bob Show. Tell me about integrative medicine. What does that mean?
Well, historically, when we talk about Western medicine, we're talking about conventional medicine. And really, we have always been very good at taking care of people that are sick, acute illnesses. But now in our society, we're really dealing with chronic illness much more. And so integrative is using the old medicine, Western medicine, which looks at acute, but also any other modalities that might be out there that we can use to help people live longer, better lives.
Now, Western medicine, conventional medicine, is getting more and more difficult because the demands of insurance companies and the demands on the doctor, they've got to rush in and rush out, and the patient says, well, maybe I'm just, only thing wrong with me is my wrist or my jaw or something. We're talking about, instead of getting those things well, we're talking about the whole person, is that right?
Right. Integrative means the whole person, body, mind, spirit. It also means that the relationship is a relationship between the doctor and the patient, but really it's the patient's responsibility in the end to take good care of themselves. I may be an expert in the things that I know, but I share that information, we discuss what's going on, we make a plan, a treatment plan, which is the goals that the patient wants in terms of their life, and that's what we use.
When a patient comes into my office, they want me to put them on a plan. What you're saying is the patient comes in and you take the history and you find out what their goals are, where their pains are, where their anxiety is, and you develop a plan for them with them part of the plan.
Absolutely.
Do patients, are they able in our American society, are they able to create that own plan for themselves with the guidance of a team?
Yes. We ask a lot of questions, and sometimes they have trouble. We will ask, for instance, what are the biggest stressors in your life? What are the things you would like to change? Of course, we always ask, are there immediate problems that you're having? And how can we help you with those? But also then we challenge them and say, what do you think your life would look like when you're 90 or 100? How do you want to be living? And that's what we come up with. How are we going to achieve that?
Do people accurately pick out the stressors that they have in their life? What are some of the things that you think are stressing you? Is it your marriage life? Is it financial? Is it joints? Are people pretty good at telling you what their stressors are?
Yeah, sometimes we have to help them tease it out, but most of the time it's like everyone else. It's usually finances, it's family relationships, it's work. Those are many stressors for people, lack of time.
And when people have stressors, does it sometimes come out in the body like a headache or like high blood pressure or like fatigue or like I ache all over and I don't know why?
Right, and that's, in integrative medicine, what we look at is the fact that one, diet is fundamentally important. Probably 60% of chronic illnesses in this country today could be changed or altered by people changing their diet. So that's very important, and we have a dietitian as part of our team.
So in your integrative team, you're going to have a dietitian, and the responsibility of the dietitian is to do what?
Every patient interacts with every member of our team. And so Our dietitian is a woman. She interviews the patient. She talks to them about what they are eating, how much they are eating, what their energy levels are, also their exercise, because she happens to be a personal trainer also. So she also wears that hat of the exercise component as well. So we get a really good history. Sometimes she'll ask them to do a food diary for a couple of weeks, but we try and see how much people are eating, what nutritional value they're eating, and then we help them make a plan, especially if their symptoms are related to either not eating enough or eating the wrong kinds of foods.
I always say in the United States we're marketed to eat and eat improperly. So every time you look at television, you're looking at advertising of food and how it'll make you feel better and you deserve a break today. And you know, and we eat a lot of fast foods and we eat out in restaurants. And is that good or bad?
Well, it started out that we were looking for convenience. So I don't want to say that to have a convenient way of eating is a bad thing, but we need lots of fruits and vegetables.
Why?
Because the fruits and vegetables give us the nutritional value that we need, give us the vitamins and the nutrients. We also need the complex carbohydrates, not simple sugars, because then that's why we're having this epidemic of diabetes, because people are eating too many just simple sugars like donuts or sodas, right? There's all this controversy about drinking so many sodas.
So what's a complex carbohydrate?
It would be something like a grain that is in the stomach longer, that doesn't just dispense or let the sugar go immediately, right? It has to digest in order to allow those sugars to come out. So it doesn't just release sugar and then insulin rises. The insulin is the hormone that brings sugar down. So you want things that have texture to them, that have a grain, an outside to them.
Can the dietitian help the person understand what's a complex carbohydrate versus the other kind that they're eating? For instance, different kind of breads and grains and whole grain, and what really is whole grain?
Yes, exactly.
Do you think that that's involved in disease process, those kind of foods?
Yes. And
you and I have talked about pro-inflammatory foods. What do you mean by that?
in the body, there are certain proteins that are what we call inflammatory proteins that rise. And now we believe that most chronic diseases are related to this chronic inflammation that's happening in the body. So things like cyclooxygenase, I know people may not know about these, but leukotrienes, okay, prostaglandins. So the foods, especially many spices like garlic or turmeric or sage, cayenne pepper, these things all can affect these inflammatory proteins and decrease them. Fish oil are anti-inflammatories, omega-3s, and that's why we think eating fish is good or taking fish oil. So all of those things are important in the diet because they would decrease the inflammation in the body.
So as you're seeing a patient in integrative medicine and the dietitian is part of the team, the dietitian you said is also an exercise...
She's a personal trainer.
Personal trainer. So
yes.
In that you've got exercise, I take as part of a personal trainer,
yes.
weights and aerobic activity.
Yes.
So she's that part. What other part, what else is there in the team?
We also have a psychologist who is a yoga therapist and a life coach, and she teaches meditation as well. So she does our mind-body component.
How do you like it? What's your experience of mind-body in our American society? What's the need?
Well, it took me a long time myself personally to recognize that we are too frenetic in our lives. We don't really maybe look enough at self-care, meaning taking time to be with people, relationships. We talk about food, but a lot of times now we don't even eat with our families at home. And,
sure.
and you know, we are also talking about not eating processed food so much, right? Trying to eat non-processed food. So like I said, the whole vegetables or the grains that are not hard to make, the protein sources that are easy. But in terms of mind body, it's just a matter of trying to not react so stressfully to things, to allow yourself to be able to take a breath when something happens, right? And you talk about laughter. I mean, the lifestyle things that help us decrease stress are enough sleep, right? Joy, being able to have something happen to you but not reacting so quickly to it in a negative way.
Can you teach people to be joyful, to be happy, to create mind relaxation, to not to worry so much, not to be so stressed and worry about everything that's going on? Just sit back, tomorrow's going to be here and you're going to be all right.
you know, people have different personalities, and some people are more prone to being more anxious and having worries. But even those people, yes, we can teach techniques that allow them, even yoga, which is a meditation technique, people can do these poses, people can breathe differently, and it makes a huge difference. It actually, breathing slowly and deeply lowers your blood pressure, slows your heart rate, it makes you more relaxed. And if we can explain that to people and show them that, they can start using that.
And you always hear, when I take a deep breath, and let all that, you're going to be all right. The other parts of your team would be?
I have an acupuncturist as well, actually a full-time acupuncturist and another half-time acupuncturist.
And that's what we're going to be talking about when we come back. We'll be talking about where the acupuncturist fits in with the psychological evaluation, the dietitian's evaluation, the internal medicine evaluation, a team approach. Are you beginning to get the idea that it's just not one person trying to do everything, but it's the whole team approach trying to make me and you a healthier and a happier person? We're talking with Dr. Rocio Huet, board-certified internal medicine specialist, board-certified in integrated medicine that we've been talking about, and board-certified in acupuncture. Rocio, tell me about acupuncture now. Where is that involved in the patient's total well-being of health?
Acupuncture is another modality that we can use to help people achieve their goals. So the majority of data right now that we have on acupuncture, and by the way, acupuncture has been around for thousands of years and is used obviously in Asia, also in Europe now, and is very effective. But if you look at the National Institutes of Health data and the studies that have been done, the majority of places it's very useful would be in migraine headaches, for nausea of chemotherapy and cancer. Actually, Sloan Kettering did a study on the effects on head and neck cancers with acupuncture, and they found that it helped with pain control. It also helped with the dryness of the mouth from the radiation.
Now,
So,
when you do acupuncture for nausea, is there a certain area of the body that you use the acupuncture? Is it on your back? Is it on the ear? Where do you, and this is a terrible explanation, where do you stick the needles?
okay, there are channels in the body in which energy flows, okay? And so you have to determine, based on what the patient is telling you, where you would place those needles. So there's no one specific place. Now, there are certain points that are very important for nausea and vomiting and chemo, and I can tell you what those are.
Where would it be for nausea? I'm interested.
Okay,
in that.
it would be pericardium 6, which actually, which is one of the important ones. It's not the only one. But you know how they have those wristbands for nausea when you go on boats? That's what they're utilizing, is pressure on that point. So there are several places. Stomach 36 is a very important point in the body and is useful for many things. The Chinese thought it could cure everything, but it's also in that same energy flow. So there are many points that can be used.
Migraine headaches?
Migraine headaches
Where?
has been very useful.
Where
Again, you know, in acupuncture, you don't even have to put the points where someone is having the pain.
Sure.
You can do them away from there. So it would actually be in the extremities, below the knees and below the elbows.
I've always been very excited in acupuncture because I've heard stories about in Asia where somebody will have abdominal surgery and they don't have anesthesia, they've just got acupuncture. So you see that it's effective in chemotherapy and nausea in patients with cancer.
And osteoarthritis of the knees, very effective, and low back pain, very effective.
So we've got now a team approach. We've got a dietitian, we've got a psychologist, we've got an internal medicine specialist, we've got an acupuncturist. How do you pull these people together, and how does the person decide how they're going to develop their own treatment?
Well, first of all, each patient sees every person on the team, and then we all get together and we have conference every week on Tuesday mornings, and we discuss certainly new patients and their treatment plan, and then if we're having any issues or problems that are coming up with patients as we're going through the year.
How long does that conference take? You've got all these 4 physicians that are there, or 4 people that
Providers.
are there. How long does that conference take? How long do you have to spend on each patient? How do you get reimbursed for that time? I've got so many questions there.
Well, it depends on the patient, how involved it can be, but I would say we meet on the average 1 to 2 hours every week, and we usually can do 4 to 6 patients in that length of time. And sometimes we don't get through, so we'll meet again. Reimbursement for their medical issues is just like it would be with any physician. For me, it's through their insurance. For other people, they do have to pay money for those services.
Are you able to bill for that round table time where it's just without the patient there in front of you? When you're talking about the patient's case, you're developing their care plan, you're talking about their health and what you can do for them. Are you able to bill for that?
I don't personally bill for that, but I guess it's part of what they are seeking and what they pay for the other services.
I think this is so fabulous. In medicine, we don't really get together with the different subspecialists and talk about the treatment plan for a patient. We don't have time to do that, and we don't do it. And so here you've got an integrative policy where you look at the mind, you look at the food we're eating. Any of those that you think is most important?
They're all important. They are really all important. You cannot miss out on, certainly the and the mind-body component are probably the most important. Acupuncture is a modality, but I think it's a very useful modality. But really, fundamentally, the other two probably are the ones that are the most important for the patient to alter, because acupuncture is an external modality that we apply to a patient. And it's just like anything. If you go out and you injure yourself, well, we can do something for you. But you have to learn how to alter your life in order not to have the problem, so that I don't have to apply the external modality to you, if that makes sense.
Absolutely. The age that will benefit most from integrative medicine, would it be the 15-year-old who develops a plan for his whole life? Would it be the 40-year-old that's undergoing the stresses of family and finances in life? The 65 or 75-year-old that's got the aches and pains from life in the past? Any of those that seem to be better for this?
Well, of course, I would argue that any age would be important. But there are people who are going to say, well, I'm healthy, I'm otherwise okay, I don't need all of these things, right?
What do you say to that? A 15-year-old that's healthy as a horse and infallible and, they don't need anything. What do you say to the 20-year-old?
Well, I would say there's a lot of things that you don't know about how you maintain health and what optimal health is, and we would love to teach you that. But then again, we can't, this is about the patient wanting to learn and be different and interact with us in a different way. So it's not for everyone. Some people who feel like they don't want these modalities or they don't need them, we don't run out to try and convince them. They have to already see that, this is something that's important for them, that they want to maintain a healthy lifestyle their whole life.
Wow, as a physician, I look at it as there's not a person in this earth that wouldn't benefit from integrative care, where you're taking a team approach to help one person. To me, that would be everybody rather than somebody. I don't need that stuff. Give me a vignette. Give me an example of a patient that came in with a problem. 78-year-old man, hypertension, a little overweight. What would you do?
Okay, first of all, we'd look and see how is he eating, because certainly if he's eating a lot of salt, drinking a lot of stimulants, caffeine, that would not be good, right? We would also want to know, is he sleeping adequately? And actually some people, lots more people have sleep apnea than we think, right? So we would look at that and say, is that fueling some of his blood pressure issues?
Now, if somebody had sleep apnea, would they have to go to a sleep doctor and get on CPAP, or could you use another modality to help that?
Right now, I would want them to go to a sleep lab and be tested, because certainly, we may try some other things, but I would not risk that for the moment in terms of sleep apnea. Now, there are, you know as well as I do, if they have mild to moderate, well, perhaps they could do an oral appliance. But that I know of in ours, certainly losing weight. I mean, if somebody lost weight with dietary changes, that would be excellent. But they have to lose a substantial amount of weight, and we would continue to monitor that with them.
When you teach the patient how to eat properly, avoiding foods that cause inflammation, eating better foods, more fruits and vegetables, more complex carbohydrates, more lean fish and chicken, what do you see happening with the patient?
Well, it's not always easy, so we have to give a lot of encouragement. And in terms of following the plan, we have people come in and they're followed up with a dietitian as often as they need. Some people, it may start once a week just because the changes are great and we make small incremental changes. But what we'll see eventually is that people, number one, they'll tell you right away, I feel better. I have less fatigue. I have less pain. If they used to have like kind of a GI upset, they usually change that. Things do change. So that's good. And of course, with this blood, if you said the 78-year-old with high blood pressure, if they lost weight, their blood pressure should come down as well, right? They'll exercise more. So we try and get them to be moving more. Everyone needs to move. It helps your brain. And we tell that all the time to people. Exercise keeps your brain intact. So we need you moving and keeps you stronger and with better balance.
I don't know that I've ever been more excited on the Dr. Bob Show listening to a team approach on how to keep better, how to get people better by using different modalities. Rocio Huet, friend of mine, brilliant internal medicine specialist. Thank you for taking the time to come and teach us about integrative medicine. It makes me want to come and be part of your office. I feel great, but I know I could do better. Thank you.
Thank you.
Fabulous, fabulous teaching. You know, we can all improve our health. We can improve how we think. We can improve our eating habits. We can improve nausea and pain if we need that by maybe acupuncture. Wow, that's very exciting to me. Now you're going to want to stay tuned. We'll be talking about the difference in some different stomach problems and also bad cholesterol. How is it bad? Why is it bad? A lot of information. I want to thank Dr. Rocio Huet. Wonderful discussion on integrative medicine. Isn't that a perfect way to treat people? And now questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob. What's the difference between diverticulosis and diverticulitis? Well, in the colon, the large bowel, sometimes there's some little outpouchings about the size of the end of my finger or even a little bit smaller, ballooning out. Those are called diverticula. They occur frequently as people get older. Maybe it's because of diet, exercise, who knows what it's due to, but people get that. Now, if those little diverticula, there's really not anything yet to do about them. But if they get infected, then we call it diverticulitis. Now, diverticulitis can range from very, very serious to very, very mild. And sometimes with irritability in the lower left side where the colon is, where most of the diverticula are, the diverticulitis can be treated with simply a liquid diet, with rest, with avoiding harsh foods that will bother people. Sometimes you'll need an antibiotic. The antibiotic sometimes is 2 different antibiotics to treat the different bacteria in that area. It can get serious enough where we have to go in the hospital and we have to have IVs and hydration that way and more sophisticated antibiotics to treat that. Sometimes diverticulitis, if it occurs frequently, like every 6 months for 3 attacks, sometimes we even have to have a segment of the colon taken out. So it can range from very serious to mild. Talk to your doctor about it, maybe see that stomach specialist. Question number 2, Dr. Bob. What does bad cholesterol really do? Well, it's a great question. The LDL, the lousy cholesterol, is the one that we want to be as low as we can. The LDL is what causes problems. The HDL goes around and grabs the bad cholesterol and takes it away. So back to the LDL. When it's in the bloodstream, it's in the blood vessels. It's being carried to parts of the body. If that LDL gets too high, then it stops because of injury or other reasons at a certain part of a blood vessel where it's then oxidized, where it's oxidized to where it develops cholesterol plaques in the artery. When we look at arteries and we take them at autopsy, we look at them, there'll be a yellowish color. That's the color of cholesterol and the cholesterol plaques. Now, if we've got a round artery, and the cholesterol plaque begins to take up part of that artery, and suddenly it will burst. That's what happens with cholesterol plaques in the coronary arteries to cause a heart attack. But it also causes hardening of the arteries. That's what we call atherosclerosis. That makes it harder for the heart to beat blood past that area. So we've got diseased blood vessels that get hardened, that can cause high blood pressure, that leads to strokes and heart attacks. So know that that bad cholesterol needs to be looked at, and it needs to be changed by diet, exercise, medication, and even integrative medicine that we talked about earlier. Well, that's all the time that we have for this show. Remember, you need to be exercising more. It doesn't matter what kind of exercise you do. It can be running, jogging, walking, swimming, working in the garden. Grab those tennis shoes and get outside and do that for at least 30 minutes and do it 5, 6, 7 days a week. Eat properly. We talked about fruits and vegetables, more fish oils, better foods, more complex carbohydrates, less sugar, less candy, less stuff that sometimes we think is good. 8 hours of sleep, and now they're saying 7.5 hours of sleep. Boy, does that make you feel better the next day. And all you have to do is count down those 7.5 hours. So go to bed early enough to wake up. If you're not sleeping well, you may have to talk to your doctor about what the problem is and how you can get that 8 hours of sleep. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. Find that person that you love and giggle with them, laugh a lot, and you'll stay healthier.